You're watching Let's Chat.
Welcome to Let's Chat, everyone. I'm Troy Thompson. I'm in the studio with Dr. Chad Esslinger from Pediatrics Dentistry and Orthodontics of Chattanooga. Welcome to the show, my friend. Today we're talking all about the treatment options for children. Okay, how are you?
I'm good. How are you?
I'm fantastic. All right, for someone who doesn't have children, but I have lots of nieces and nephews, so I do take a little bit of input when it comes to their raising. So I want to ask and go back to my family and give them some guidance, and that's what we're here about today. When should someone start going to the dentist as a child?
Well, Troy, the American Academy of Pediatric Dentistry recommends that all children be seen by their first birthday. So we see patients starting at 1 year old typically.
Okay, the difference between a pediatric dentist and a normal dentist, is there one?
Yes, there is a dentist.
Okay.
You know, everyone knows, like the orthodontist, they do extra training, but also the pediatric dentist is typically a 2 to 3 year residency program.
Really?
So
on top of your normal dentistry?
That's correct. So after dental school, it's a 2 to 3 year residency program in which you do hospital training, you do sedation training, growth and development, you do some orthodontics. So 2 years of extra training is what the pediatric dentist has.
What are you looking for if someone comes in at like 3 or 4, 5, 6 months of age?
Okay, so let's talk about that 1 year old visit. So at the 1 year old visit, we're gonna do a lot of counseling with the mother. We're gonna talk about diet, we're gonna talk about oral hygiene, we're gonna talk about pacifier use, we're gonna talk about thumb habits. We're gonna go over a lot of these preventive things with the parent. I always call it a mommy visit almost. It's for the mother.
I think that's great.
So it really helps to train the parent on what they need to do as the child grows up.
For people sitting at home, now you brought up pacifier and sucking the thumb. My sister did that a lot, and she got very bucky teeth. Is that the correct terminology?
Yes.
I'm not quite sure how to say that. But where do you sit when it comes to pacifiers, and what damage can that do to a newborn's teeth?
Well, typically either the pacifier or the thumb, they're going to cause the child to grow with a more narrow palate. They're going to develop things like a crossbite. So when you come in at that 1 year old visit, we're going to talk about when do you stop the pacifier? When do you stop the thumb? What are your options? And we're just going to kind of work through the parent how we can stop those habits.
Options? I want you to tell me.
Well, you know, the good thing about the pacifier is, Troy, you can get rid of it. You know, you can take it away. So we like for the pacifier to at least be gone in that 2 year old range.
Okay.
So, you know, having kids myself, I experience these problems. So, and the thumb can be a little more difficult because you have to have some compliance from your child to stop sucking their thumb. So when we get to that age that they're compliant, that they want to stop sucking their thumb, then we're going to talk about those options.
Well, listen, people are sitting at home right now, new mums, who are watching you, and they're thinking to themselves, gee, maybe I should start brushing my new one's little teeth. You know, should they be using normal toothbrushes, or are there special baby ones? Normal toothpaste? Is there special baby toothpaste?
Right, so those are great questions. So typically toothbrushes come in age-appropriate sizes.
Perfect.
So when your child comes to the dentist, we're gonna give them an age-appropriate size toothbrush. And then as far as toothpaste goes, we get that question a lot.
Right.
So when your child is 2, you can start using a small amount of fluoridated toothpaste.
Okay. I want to talk a little bit about cavities for little ones. What are your treatment options for them?
Well, I can tell you that.
Because I know what I'm like when I have a cavity.
Right. And so, you know, I'm going to tell you, that's the thing we get most from parents is like, wow, I had a bad experience as a child, and I do not want my kid to have that bad experience. So, you know, we want children to have a great experience when they do experience something like a cavity. So we have several options. Option number 1 is we do some kids with nitrous oxide in the office, laughing gas. So everybody knows about the laughing gas. And then the second option would either be a sedation, or we even do hospital treatment in the hospital.
And maybe a third, very quickly?
Third, besides the hospital.
Happiness.
Happiness, yes.
Do you like that one?
I do.
I got that. Thank you so much. We really appreciate you. If you want to find out more information, there it all is up on the screen for you. I've been chatting away with Dr. Chad from Pediatrics Dentistry and Orthodontics of Chattanooga. Back after this short break.